Hello, I'm Dr. Fernara with Phoenix Mobile Veterinarians, and today I am here to talk to you about dogs and when they undergo anesthetic procedures. With my assistant Rebecca, we have a few questions that I'm happy to answer.
Dr. Fernara, when would my dog need anesthesia?
Anesthesia is used when pets have certain surgical procedures that we need to have them stay still for. Also, with other diagnostic procedures such as x-rays, ultrasound, physical exams. If there's aggression, we do have to use anesthesia to help keep them still so we can fully evaluate your pet.
What are the different types of anesthesia?
So with anesthesia, we have sedation, which is more of a twilight zone. These are used for shorter procedures. Uh, Again, physical exams when maybe we're not able to look in a pet's mouth due to pain, or if a pet doesn't want to hold still for us while we need to do a blood draw, we can give them a little bit of medication that will help keep them calm. These are usually reversed and the pet is awake and up and moving around within minutes after we complete the procedure. General anesthesia is for more in-depth procedures. This is when we need to perform a surgery or a longer procedure where we need the pet to be completely still and asleep for a longer period of time than just a quick twilight zone.
Are particular dog breeds more sensitive to anesthesia?
More so than the breed of dog, it's a condition that can cause sensitivity to anesthesia. And these are things that we will talk with you about if your pet is at a risk for them when we perform our pre-anesthetic exam.
What do I need to know before my dog goes for an anesthetic procedure?
So the first thing is meeting with your veterinarian to talk about the anesthetic procedure and any potential risks. We always perform a full physical exam to ensure that your pet is at its optimal health for that procedure. We also perform pre-anesthetic lab work. This will ensure that the pet can tolerate the anesthetic medications that we are giving. If we need to change those medications due to certain conditions we find with lab work, we can do that at that time. We also, during our initial meet prior to the procedure, we will talk about fasting, so making sure your pet doesn't eat a big meal prior to their anesthetic event, and any other concerns you may have.
What monitoring will be done by the veterinarian to ensure my dog is safe while undergoing anesthesia?
So similar to humans, we monitor vital signs under anesthesia. So that's going to be your heart rate, your respiratory rate, your temperature. We also are monitoring blood pressure, the oxygenation of your pet, and the carbon dioxide levels of your pet. These are done by a technician who is assigned to your pet from the beginning of the anesthetic procedure all the way through into an hour plus post anesthetic procedure. We do have monitoring. We monitor vitals anywhere from every 5 minutes during the procedure to every 15 minutes in recovery.
What do I need to watch for at home after my dog has undergone anesthesia?
The big thing you want to make sure is that your pet is moving around, acting like themselves, doesn't seem painful, extreme vocalization, drooling, excessive drooling. They're not vomiting. They are wanting to eat. It is common to see them a little bit sleepy after their procedure. Sometimes they don't want to eat a full meal within 12 hours after the procedure. That can be very normal, but we want to make sure within 24 hours after their procedure that they're up, moving around, eating, and acting like themselves. Thank you for your questions. And if you have any further questions regarding anesthesia in your dog, we are happy to answer them. Give us a call here at Phoenix Mobile Veterinarians.